Hi, welcome to Ask Dr. Tan. It's our new series where we look at all the questions that you guys ask us on our social media, we consolidate them, and then we try to answer them as best as we can. This week, the topic, very interestingly, is on the penis. Now, the first question is a question that we get a lot, and I think a lot of people are very concerned about it, which is, how big should my penis be? Okay, so as doctors, right, we don't really talk about enhancing a normal penis. We talk about what is a pathological micro penis. In other words, how small is it before we think that there's actually a disease involved, like a lack in hormones, or a patient was born with some kind of genetic abnormality. So even before we answer this question, we have to ask the question, how do we actually measure the length of the penis? So how doctors do it is by this method known as stretch penis length, right? So what you do is you feel for the pelvic bone, right? You don't measure it from the skin surface because people who are a little bit bigger, there might be a lot of fat under the skin, so it will actually make the penis look a lot shorter. So you have to push all that down and feel for the pelvic bone. Then from the pelvic bone, you stretch the penis out, and then you measure that length. Because some people in a flaccid state, the penis is rather shrunken, and also for environmental factors, so you're not actually measuring the true length of the penis. So from the pelvic bone to the tip of the penis, the stretch penile length, that is what most doctors would use as a standard. As a very, very rough gauge, anything under 10 centimeters might be abnormal. You should see a doctor and get more investigations done, or at least get his opinion on it. Anything more than that should be normal. All right. So second question, are there any injections to increase the size of the penis? Okay, so again, we don't really advise on enhancing a normal size penis, but the fact is, some doctors use filler injections to increase the girth of the penis. So fillers are basically it's like a gel, a natural forming gel that we can inject under the skin of the penis to make the girth bigger. Now, obviously, there are risks involved with that, and there are certain side effects, so it's something that you should discuss with your doctor if you want to consider it. Another query that we get a lot with regards to injections increasing the size of the penis is PRP. So PRP, or platelet-rich plasma injection into the penis to treat erectile dysfunction, has been gaining a lot of popularity lately. There are some studies to say that it can improve penile girth and length, but again, we really don't advise it as a standard treatment for increasing size. And the last question is, does having ED make my penis shrink? This is a very interesting question. Unfortunately, the answer is yes, especially if it's vasculogenic ED. So one of the common causes of erectile dysfunction is poor blood flow into the penis, right? So just like any organ in the body, if there's poor blood flow, the tissue can become unhealthy and undergo a process known as atrophy. That means it starts to become, well, unhealthy and shrink. So similarly, the penis is not getting healthy blood flow, which is actually why we get these erections in the middle of the night. So our body trying to push fresh blood into the penis. So if you're not getting that, then what happens is the tissue gets unhealthy, the penis can actually shrink. So there have been a lot of studies to show that certain treatments, for example, daily use of PDE5 inhibitors to improve blood flow into the penis, can actually improve size, as in bring back the normal size, not make it larger than it previously was. Bring it back to the size it usually was. And there's also animal studies to show that daily use of PDE5 inhibitors can improve the health of the cells and the health of the connective tissue between the cells in the penis itself. Right? So, okay, that was a very interesting set of questions. We'll see you next week for the next topic.